I'm Dr. N.K. Venkatramana, neurosurgeon, Brains Super Speciality Hospital. So, maintenance of balance and a standing posture is not a simple thing. We all of us start walking, sometimes running. A lot of people do specialized activities like acrobatics, sports, dance. All these requires a lot of movements associated with the balance. Now, even simple walking requires a lot of balance because we walk at different geographic terrains, different situations, staircases, uneven surfaces, day and night. All these can make a lot of difference. This is not a simple thing. A lot of parts of the brain like frontal lobe, motor cortex, sensory cortex, cerebellum, brainstem. There is a balance organ in the ear, inner ear, the balance nerve and the spinal cord. All of them have to work together to produce this perfect balance so that we walk steadily. And each one walks in their own style. In fact, sometimes people recognize them by their walk alone. That is because they have a very characteristic walk. So that means the sensations, the muscles, the joints, and the style of walking, posture, everything matters in maintaining the posture. Now, for variety of reasons, one is the age, and apart from that, infections, viral infections, ear infections, tumors, some degenerative diseases, multiple sclerosis, stroke, and some inflammatory conditions of the vestibular nerve can produce sudden dizziness or giddiness, where you feel you are suddenly losing balance and the whole house is rotating and they vomit, sometimes they fall down. They feel very diffident or less confident to walk because they are not able to maintain their own posture. Now, this is because of variety of reasons in the brain, either the motor cortex weakness or parietal cortex, cerebellum, vestibular nerve, inner ear, balance nerve, brainstem, spinal cord, and blood supply to all these organs causing the stroke, cause vertebro-basilar insufficiency. Any one of these causes can produce this problem. But many a times, it is not such a serious thing. It is called benign positional vertigo. That means the balance organ becomes non-functional and suddenly any change in the position, it gives a wrong information to the brain so that you feel very unsteady and dizzy. So, to assess this, where exactly is the problem, Brains Super Speciality Hospital has established an exclusive Vertigo Clinic because a lot of people suffer from this and they feel they are very disabled and they need assistance of a stick or a person to walk along, which makes them feel very unhappy and depressed. So, to assess them, starting from the ear problem to the balance nerve to every neurological structure, including their blood flow, we do a variety of tests together so that we identify the exact problem where it is, so that we can treat that, number one. Number two, if there is a problem which is causing some disease, that can be controlled or minimized. If there is a blood flow disturbance, we can enhance that. And if there is a tumor which is picked up in a scan, once you remove the tumor and they become all right. So the treatment has to be very specific, related to the cause, and that cause can be identified by doing a battery of tests. One is called a vertigo testing, which tests almost all these nerves in one single shot in about 1 to 1.5 hours. After that, we do a scan, we check the blood flow, and treatment depends on what is the exact cause and what is the part of the brain that is not functioning well. So it includes medicines, very good medicines to improve the blood circulation, and lifestyle modification, gait therapy that can help them, balance nerve to get adjusted to the position. We can teach them some exercises, we can modify the diet, and the existing diseases such as diabetes, which will make them prone for such diseases, also need to be treated. So if you put all these treatments together in a nutshell, they do very well. Either don't feel that they are disabled, and then they can be very active in their life. So, and do's and don'ts in the life can be taught to them so that they can be independent. So the Vertigo Clinic is very important. It is not life-threatening symptom. It is only a symptom, and there can be an underlying disease which need to be identified. Earlier we identify and treat, better are the results, and better is the damage control for the brain.